which is focused specifically on the needs of sexual medicine and allied sciences treatment. So very often we find patients lingering here and there and very often falling into trap of quacks and those doctors which are not qualified enough to treat these kind of patients. So with the objective of providing quality healthcare in field of sexual medicine, an idea was conceived and concepted in the form of IASMPMM, that is International Association for Sexual Medicine Practitioners, Modern Medicine. What does modern medicine mean? That is MBBS and above. So we strictly follow the ethics and guidelines. We never allow anybody who is below MBBS to attend our conference. We are not allowing anybody today also, neither in the past, and we'll not allow in the future also. So it is a very strict guideline we follow. As per the NMC guidelines, we follow modern medicine and we only cherish inclusion and involvement of modern medicine practitioners. In the guiding light of our international chairman, Dr. Ajayan sir and Dr. Theresa sir, we'll be conducting today's conference also according to the same ethics and values. So, first of all, why we have chosen to start this conference or why we have brought this here. So it is an immense pleasure to tell you all that next year, in September 2024, we all are planning to have a full IASMPMM conference in Delhi itself. That is, for the first time, we will be having a full 3-day conference with workshops on sexual medicine, which has never happened before in the history of Delhi NCR medical circle. That conference will definitely provide you a broader picture of what is happening, what is new in the field of sexual medicine, how sexual medicine has evolved in the past few years in India, and how we can help our patients who are coming every day for their sexual dysfunction needs. So in preparation for that event, we have decided to bring together all the doctors who are interested in sexual medicine practice to this platform, which will provide you a basis of what we are going to do next year. So in the process, we are also going to offer you a chance to join IASMPMM membership. Forms will be soon placed on your tables and you can fill it and you can go through the all details and payment details present in the form. I'll definitely come through to that point, but Dr. Ajayan will be telling you in detail. So now let us come to our main agenda. We are going to start our program in 5 minutes. So I request all the delegates and dignitaries to kindly be seated inside the hall. I welcome our chief guest of today, Dr. Gladwin Tyagi, who is IMA East Delhi branch president. He is also my elder brother, but then he has done so much of work in the field of medicine in this area that if I start telling all the details, it will be a long 1-hour lecture. But in brief, I'll just give a very small introduction. Dr. Gladwin Tyagi is MBBS MD and MBA from FMS. He's a chest and critical care specialist. He is currently Chief Medical Officer, Municipal Corporation of Delhi, President of Indian Medical Association, East Delhi branch. He is the patron of Paryavaran Mitra Registered Organization, President of Indian Council for Health and Family Welfare. He is an advisory board member for Swasthya Seva Shiksha Samiti, Vice President of National Medicos Organization, Delhi, and is an executive member of Delhi Medical Association. These are few of the highlights which I have provided, and there are much more things he has been doing. He's been actively involved in providing healthcare facilities to the poor and downtrodden, has been a big corona warrior, and has worked relentlessly for 2 years during the COVID outbreak, and he successfully managed a 40-bedded ICU all on his own in MCD hospital while the Delhi was languishing in the grips of COVID-19 second wave. So with this, we come to our next dignitary, Dr. Ajayan Varghese sir. Sir is the founder chairman of International Association of Sexual Medicine Practitioners, IASMPMM. He is the director of Institute of Sexual and Reproductive Medicine, and he did his MBBS from Government Medical College, Kozhikode, Kerala. He has been into practice of sexual medicine for last many years, has already managed 24,860 cases of erectile dysfunction, 22,356 cases of premature ejaculation, numerous cases of sexual counseling, and he has successfully conducted many conferences, including 2 IASPMM successfully conducted conferences in 2022 and 2023. So that is a brief introduction of Dr. Ajayan sir. And now coming to our third dignitary, Dr. Mahendra Nath Thareja, an honorary professor, and he is practicing in Alwar as general practitioner for last 45 years and a sexual medicine practitioner for last 25 years. He is a president, International Association of Sexual Medicine Practitioners, vice president of Council of Sexual Education and Parenthood International, Golden Lamp awardee in 2022 by CSEPI, joint secretary finance IMA headquarter 2022 to 24. Sir is working relentlessly in providing quality sexual health care in and around Delhi NCR area. He is a renowned name, and if you search by name of Dr. Thareja, you will definitely come to know how what is the magnitude of work he's been doing in the field of sexual medicine. So I welcome all the three dignitaries on the dais. Kindly please come on the dais. We'll shortly be starting with lamp lighting ceremony. So I request Dr. Akhil to kindly felicitate, Dr. Akhil and Dr. Alka to kindly felicitate our dignitaries. Dr. Alka. So I request Dr. Alka to felicitate Dr. Gladwin. I request those who are outside to please come inside the hall. I request Dr. Akhil to please provide, Dr. Akhil please give memento to Dr. Gladwin. Dr. Akhil Agarwal, who is organizing secretary of our conference, is a renowned psychiatrist from Kota, and he has come very long way to attend and help in organizing this conference. So a big round of applause for him also. Dr. Alka is a sexual medicine practitioner from Bombay. Ma'am has been doing a tremendous work in NACO and National AIDS Control Organization, and she has come all the way from Mumbai to provide help and support for the conference. So big round of applause for her also. I request Dr. Alka to kindly felicitate Dr. Ajayan sir with the planter. I request Dr. Akhil to kindly provide memento to Dr. Ajayan sir. Now I request Dr. Alka to kindly felicitate Dr. Thareja sir, Dr. M.N. Thareja sir with a planter. I request Dr. Akhil to kindly felicitate sir with the memento. Thank you very much. So I now invite all the dignitaries, Dr. Akhil and Dr. Alka, to kindly come and start the lamp lighting ceremony. So I request all the dignitaries to kindly come for the lamp lighting ceremony so that we can start with this later on. Ma'am, I invite you also to please come and join us for the lamp lighting ceremony. So I thank all my dignitaries for providing us an opportunity to felicitate them and coming here to make our event a successful one. Now I invite Dr. Gladwin Tyagi to kindly provide his encouraging words for our today's conference and how we can improvise if there are any suggestions. Thank you.
धन्यवाद डॉक्टर वरुण। सर्वप्रथम उत्सव के आयोजकों को बहुत बहुत बधाई एवं शुभकामनाएं। अगर वास्तव में देखा जाए कि इस बधाई का कारण क्या है, तो मैं यही कहूँगा कि आप लोगों ने उस विषय को पकड़कर आगे आने का बीड़ा उठाया है जिस विषय पे आज जैसे आधुनिक युग में भी बात करते में लोग कतराते हैं, और जिसका नुकसान ये होता है कि जो आधुनिक समाज में दिन प्रतिदिन की जो समस्याएं हैं, जिस प्रकार का तनाव व्यक्ति के ऊपर है, उसमें ये समस्याएं होना बड़ा लाजमी सी बातें हैं। तो मुझे लगता है कि उत्सव के आयोजक ना केवल पूर्वी दिल्ली में इस प्रकार के आयोजन करें, अपितु समस्त भारतवर्ष में इस विषय के ऊपर चर्चा होनी चाहिए। यदि आप देखें तो हमारी सनातन संस्कृति में, हमारे अगर आप पौराणिक इतिहास में जाएं, तो यह विषय हम लोगों से कहीं अछूता नहीं रहा है। अगर मैं बात करूं कामसूत्रा, तो कामसूत्रा कोई किंवदंती नहीं है, कोई कहानी नहीं है, वह एक ग्रंथ है जो केवल इसी विषय पे लिखा गया है। तो आप समझ सकते हैं कि यह विषय अपने आप में कितनी महत्व रखता है। और मैं यही कहना चाहता हूं कि इंडियन मेडिकल एसोसिएशन पूर्वी दिल्ली की ओर से जब भी कभी इस प्रकार के आयोजन करने के लिए आपको स्थान की आवश्यकता हो, आपको अन्य किसी हमसे अपेक्षाएं हो, तो हम उसमें आपके साथ रहेंगे। और पुनः एक बार आपको बहुत बहुत बधाई एवं शुभकामनाएं। धन्यवाद।
Thank you for your so kind words. And now I invite Dr. Ajayan sir to provide his keynote lecture on why and how sexual medicine is evolving in India and what is his vision on this regard. Sir, Dr. Ajayan sir.
Good morning. I thank Dr. Varun Tyagi, Dr. Akhil Agarwal, and all of the organizers for allowing me this platform. Practically speaking, sexual medicine is not a subject which is taught in medical schools or universities. But in actual practice, each and every MBBS doctors once in a while face a sexual problem, sexual dysfunction. The patient asks whom to contact, whether surgeon or physician, endocrinologist or psychiatrist, urologist or gynecologist. Actually, sexual medicine is a multidisciplinary subject. It includes endocrinology, neurology, gynecology, urology, andrology, psychiatry, and dermatology, and all of the branches of medicine. What we do in actual practice, there is no proper NMC approved sexual medicine course. That's why each and every sexual MBBS doctors can practice sexual medicine. But how? The condition is that no one is properly trained. 2 to 3 decades ago, when or 40 years or 50 years back, there were no sildenafil or PD5 inhibitors was not present. During that period, MBBS doctors or modern medicine practitioners were reluctant to practice sexual medicine. They refer this case to psychologist or psychiatrist. Each and every sexual dysfunctions were labeled as psychological disorders. Even diabetic erectile dysfunction was treated by psychologists. going on sessions and sessions, and the organ remained flaccid itself. They couldn't raise the organ. Fortunately, PD5 inhibitors, that Viagra came into the picture, and this branch started. That means this branch developed. Due to this drug, that means Viagra, that means we must consider the other drugs also, penicillin, Alexander Fleming, and insulin. Then the third drug comes, Viagra. It helped lot of, it made lot of changes in human. One more thing is that if PD5 inhibitor, that Viagra was not there, then sexual medicine could not flourish like this. Now, who is sexual medicine practitioner? I told that there is no proper course, proper training is not there. That's why each and every one, that those who are practicing sexual medicine is afraid of how to practice it. Here comes the role of IASMBMM. Previously, quacks were flourishing like anything. That means Unani, Ayurveda, or Siddha, Homeo, all these doctors were practicing sexual medicine, and they give